we've been discussing here, it seems like Queen Elizabeth, her health, at least by the statement that the palace put out, may have taken a turn. So we're monitoring this very closely.
Yes, we've been monitoring this breaking news throughout the day today. Doctors expressing what they call serious concerns about the Queen's health at this hour. It is an unusual statement that we just got issued from Buckingham Palace. The royal family is said to be headed to the Queen's bedside in Balmoral, that's in Scotland, where she is under medical supervision. So let's turn now to ABC's Maggie Rulli, who is in the UK, for the very latest on this developing situation. Good afternoon, Maggie.
Hey guys, good afternoon. Yeah, we're here in Scotland. We came almost immediately as soon as we found out that the Queen had missed a virtual meeting yesterday. That was sort of the first hint that something could be wrong. But, Amy, you just mentioned that medical supervision, this statement from Buckingham Palace. This is what's so concerning right now. It's highly unusual and quite significant to get such a detailed statement about the Queen's medical history. Quite often they're very vague, especially in the past when she's had to go to the hospital. So getting this type of information is very unusual. I want to read it in full for you guys. They said, following further evaluation this morning, the Queen's doctors are concerned for Her Majesty's health and have recommended she remain under medical supervision. The Queen remains comfortable and at Balmoral. So clearly a lot to be concerned about. The Prime Minister here in the UK even using those words exactly, saying the whole country is deeply concerned this morning. But guys, it's more than just people here in the UK. It feels like the whole world is deeply concerned right now.
Well, we certainly are. And Maggie, I know that we mentioned members of the royal family heading to her side. Do we know where they are, where they are in the world and how close they are to being with her?
Yeah, at this point, it appears that all four of her children are either at her bedside or making their way there. We know Prince William has made it to Balmoral, and the Sussexes have confirmed that both Prince Harry and Meghan are making their way to Balmoral as well. And, I have to say, guys, for me, when I heard all of those family members were coming in, rushing to her bedside, that's kind of when it hit home that this is a grave situation. This is something that we have to be taking seriously. And, of course, they're there. They want to be there for their mother, for their grandmother, for each other. And I think it just drives home that this is something that is deeply concerning right now.
Maggie, you said it hits home and deeply concerning. Look, we've been covering the Queen and her health, it seems like, anytime something comes up. She's 96 years old, but we saw her at the Jubilee, right? That was celebratory. She had to miss some events because of mobility issues, but still, it wasn't necessarily this level of concern. So have you gotten a chance to get a feel for what the tone is, the mood is for the folks around the country there who this is a beloved Queen?
Yeah, TJ, you said it perfectly. I think having the Jubilee so recently, we sort of saw once again what the Queen means to the country here. And right now, I have to say, people are kind of just holding their breath. It almost feels like the whole country, the whole world is just collectively on edge, waiting for what's next. On one hand, 96 years old, yes, this is expected, yet somehow it still feels shocking. There's this element of surprise. The Queen has been so constant, so steadfast, on the throne for 70 years. She's the face on coins, on stamps. She's a part of the fabric of British culture and society. And so all of a sudden to start thinking about that being potentially gone, I mean, it's almost hard to wrap your mind around. And I think while at 96, we know something like this could happen any day, talking about it with you guys right now, talking to people here, everyone's still sort of in shock. Can't believe that this is happening right now.
Maggie, you make such a good point that even though she's 96, you get a sense of her that she's going to outlive all of us because she's still kept up such a good schedule. We remember being there, Robach, for the Jubilee and seeing her step out on that balcony, strong. She stood there, yes, and she looked great. So you make a good point there, Maggie. It's still it's a bit of a surprise and a shock. Thank you for keeping us up to date. Maggie Rulli there in Scotland. We'll check in with you again if needs be.
Yeah, and she is the only Queen that most people in the world have known because she has been on the throne for 70 years. Right? I know, Dr. Jen, you've been monitoring the health bulletins that have been coming out of the palace today. We've been talking about how this is a very unusual statement from the palace. We don't get usually any kind of details. We know she's been placed under medical supervision. What does that technically mean?
Well, I mean, first of all, in this country, that's not a term that any doctor or medical professional understands. That's palace speak, not really medical lingo. Medical supervision in Her her palace or in Scotland would probably mean that her doctors and her medical team are following her vital signs. She may or may not have a pulse oximeter on, checking not only her heart rate, but her oxygen saturation. Maybe they're monitoring her heart rate. It depends how aggressive they want to be. But the key, and Maggie alluded to this, is when doctors start suggesting that relatives close to the patient come to the bedside, that's usually because the vital signs are not stable and the patient would be in critical condition. So again, this is all speculation because, as you and everyone has noted, the palace does not normally say anything about the Queen's health. So there's a lot of reading between the lines on this one.
And whatever care she's getting, like she's staying there at her palace, but she can get the very best care in the world from there. It doesn't.
Well, I think it's significant that she's not been brought to the hospital. I think that in general now, with a 96-year-old is appropriate because you would like to think that that person and their family have had a discussion about how aggressive they want to be with interventions. And, at the hospital, doctors and nurses do a lot of interventions. So we're talking about even end-of-life issues, things like do not resuscitate orders, do not intubate orders. We all know that death is inevitable for all of us. So when someone is close to that condition, these are important conversations that they would have with the family and their doctors. And so keeping her at home, out of a hospital, is likely one of, speaks to those discussions.
Yeah, certainly someone like the Queen, I'm sure, had all of those medical protocols put in place, anticipating that she is 96 years old, and we have seen her health start to decline, and she knows the world is watching, and this is important because there is a progression, there is a way to move forward to hand over the crown, so to speak.
Yeah, absolutely, and I think that the one word that I was glad to hear coming out of the palace's official statement is that she's comfortable.
Yeah.
We have a saying, comfort measures only, so that's making sure that the person is not in any pain, not in any discomfort.
All right. Well, again, might be some realities here, but certainly we'll always still wish for the best with the Queen. We have seen her time and time again, defy.
For sure.
All right, Dr. Ashton, thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.